As more and more flights carrying migrants from Texas arrive here in San Diego, local health officials are trying to contain an outbreak of the flu at a shelter downtown. County health officials confirmed a dozen new cases among asylum seekers flown to San Diego from Texas. The agency has identified a total of 47 people with flu symptoms since the flights began on May 19th. Nearly 300 people at a migrant shelter in Bankers Hill have received a health screening. We have Congressman Scott Peters joining us now to weigh in on this and a couple of other issues. Thanks for coming in, Congressman. Sure appreciate your time.
Morning, Eric.
Let's talk a little bit about the migrants that are coming here. Any concerns you have, first of all, for them coming here from Texas, being flown in, and their health as well as the health of the U.S. workers that are at these shelters?
Well, Eric, thanks for raising it. I visited the shelter on Friday. It's a remarkable operation. Spun out of a lot of volunteers who really cared about migrants who suddenly were being dumped on the streets, asylum seekers.
Right.
And so our local community has picked it up, and the state has come together with the county, and so they're taking care of the problem. This adds to the difficulty when they're sent plane loads of people who are infected with the flu, and when people get on the plane, they will not admit that they have the flu.
Sure.
Because they're very concerned about not being processed.
Right.
So that's an additional challenge. Fortunately, we've got a lot of volunteer doctors and healthcare professionals who are dealing with it. I think they'll deal with it, but I think at root, it's something that the federal government should never have surrendered or given up on. I think that it's the federal government's job to take care of these issues, not to leave it to a bunch of volunteers, as well-meaning and competent as they are. It's just not the right thing.
How long will the flights be coming here? I mean, what's the end result? What's the timeline? How are you thinking?
The Trump administration doesn't call me and give me an update. This is all a very surprising kind of development. In October, they changed the policy of taking care of these asylum seekers themselves, and just started putting them at the bus station downtown. So they don't give us a lot of notice about what their plans are, and I think the notion that Texas is overwhelmed.
Sure. It
may be that they get more people who are being apprehended outside the border crossing, but we have the busiest border crossing in San Ysidro in the Western Hemisphere.
Right.
So we've got our own challenges, and I think they've noticed that the state of California has come in and picked up some of these costs.
You've publicly stated that you wouldn't be surprised if Congress pursues impeachment proceedings against the president. We've been hearing that a lot in the headlines lately. Your thoughts on where the process stands and what needs to be done?
Well, first, I'm very conscious that a lot of Democrats got elected in 2018 talking about health care, talking about giving the middle class a chance, talking about environment and climate. We've got real work to do, and I'm not on the committees of jurisdiction, judiciary oversight, and intelligence that would deal with impeachment.
Right.
So I'm going to work on those things, and I think we owe that to the country. But oversight is part of Congress's job, too. It's in the Constitution. We're a separate branch of government. We're a co-equal branch of government. There are two things that are facing us. One is the Mueller report, even with the redactions,
right,
shows 10 instances of obstruction of justice that are at least as serious as what Richard Nixon did. And I think you see that if you look at the report. And at the same time, you've got the president saying he's not going to respond to any subpoenas. So he's totally thumbing his nose at the United States Congress. We don't have a lot of options in the Constitution. So what I'd like to see is I'd like to see the president let his people answer questions pursuant to the normal process that's happened with other presidents and other presidents have cooperated with. But if he doesn't do that, I think we're headed down that road.
Let's touch on your health care. The House passed a package recently, and it went through your committee to lower drug costs, because I think a lot of people watching this right now are saying something needs to be done.
Yeah, well, there's a lot of work left to do. I think the thing that consumers see is the amount they pay for drugs. That's a big part of health care costs. So we've done some work in a bipartisan way to stop the gaming around generics. So make sure that when drugs are ready to go off patent, they go off patent, and that they can go into competition. There's some pretty big things in there. We've got a lot more work to do, but I think you'll see these bills pass the Senate and actually get signed by the president. That's what people are looking out for.
Real quick, the Service Members Support Network bill, that's just something that's incredible.
One of the things that we found is that we have a very high suicide rate among veterans, 20 per day. One thing is when they come home, the best thing you can do for them is to provide peer support.
Right.
But because of the restrictions on releasing data about people, often a young man or woman's own parents might not know what they're going through. So this provides the ability for the veteran or for the the service member to consent up front. These are the people I want you to tell about what I'm going through, so that if I hit hard times, I'll have a support network and maybe I won't turn to suicide, feel so hopeless. It's a great thing inspired by a couple, Gene and Howard Somers
Here
out
in
of
Coronado, right? Yeah.
who lost their son, Army captain who did 2 deployments to suicide in Arizona. They've made it their mission to make something out of his life.
And I help out a lot of people.
It's a fantastic thing.
Real quick, we saw before this interview the lawmaker who had the egg cracked on his head. Ever had anything crazy happen to you during an interview?
Eric, don't give anybody any ideas. I've had people mouth bad words.
Yeah.
But so far, nothing like that.
No, good.
Or a milkshake, by the way. That's the England trend.
Right, yeah. You don't want that either, especially with the nice suit you have on here today. Representative, thanks so much for coming in. We sure
Thanks, Eric.
appreciate it.
Thank you.
Heather, let's get